So we're here again digging into some research papers that I've identified and attempting to pull out possible clinical applications. So there's two papers we're drawing from today, and what we're talking about is essentially there's a lot of papers on this concept, but within motor learning, explicit learning versus implicit learning. So implicit learning is essentially learning that happens no matter what. So every time you do something, you gain some information from it, or you gain some learning from it. So I go to identify my patient's wrist, right? I hold here, right? It could be sloppy, it could be jumpy, I could be missing, but every time I do it, I'm probably going to improve my capacity to identify the wrist and be smooth. That's very likely to happen. Explicit learning is, as it's stated, it's very clear, right? Now, explicit learning often is accompanied with feedback, at least in experimental settings. So if I was trying to find the ASIS, somebody can tell me the process, and I can go ahead and I can try, and I can miss. So I'm up in my patient's abdomen, I've contacted his lower ribs, or the common costal cartilage, or the inferior border of it, so I have missed. All right, I've missed the intended target. Somebody can then give me some feedback and say, okay, what you're going to do is you're going to contact the thighs of the patient, essentially along the seam of their pants. You're going to use your eyes, and you're going to look around their belt line. You're going to come up, and with broad hands, you're going to run into bone. When you identify that bone with the palms of your hands, then you can hook under the ASIS. So there's a whole motor process there, but I can miss, right? And then somebody explicitly provides me feedback to identify what we're actually trying to do and to actually help me learn. Now, one of the things that they've shown with experimental processes is that they provide people explicit feedback or explicit learning opportunities and processes, so suddenly somebody is able to achieve the target more accurately. What will end up happening is, so we go through the whole process of identifying the ASIS. Now, if somebody tells me to stop using the strategy that I've learned, now I can start getting back into error situations. So they tell me a complete different thing. No, that's the wrong way. You just take your hands and you plop them down on the ASIS and you'll never miss. And so if somebody gives me poor advice, explicit learning tends to be quite flexible, so it can change quite easily depending on the feedback that's received. So this is where educators need to be very, very careful about the feedback styles, and really understand them. And anybody can start looking this up, anybody can start doing learning on their own as far as good feedback strategies, but you want to really pay attention to that. The implicit learning will happen over time. It tends to be quite rigid and compared to the flexibility of explicit learning. So it's basically about the instance by instance situation. So I've picked up the hand and I missed the wrist. I pick up the forearm and I completely miss the wrist. I grab his hand around the carpals and I squish his hand, right? And I know that that's not what I'm trying to do. I'm trying to identify the wrist. So each time I do it, I make a mistake, and I can learn over time. I can become smoother. My motor pattern can become more refined. So we just want to understand and put out there the concept of implicit versus explicit learning. One of the things with implicit learning is it's something that is probably happening in a lot of practitioners with quite a bit of experience. What's happening is every time they work with a patient, they're going to learn something new, which is why you'll get statements from some experienced practitioners that at a certain number of treatments, all of a sudden their skills seem to explode. Or you'll get statements such that, you know, I used to miss my target, but now all of a sudden I hit my target more often than not. And that is really a story that is told about something that is probably, not absolutely, but probably the long-term process, the slow, rigid process of implicit learning. So when people tell you, you got to put your reps in, or that you have to continue to do this, one of the things that they're probably pointing to is the concept of implicit learning. Now, one of the ways it's at least possible to improve the learning process so that you do a better job early on is through explicit learning processes. So getting good feedback, as we showed with the example of identifying the ASIS, and that could be done anywhere.